Welcome to our presentation on harm reduction peer backpack and vending machine project. My name is Danielle Radchenko and I'm a public health nurse from the Woodminster, Meadow Lake, North Balford and rural areas in the northwest region of Saskatchewan. I'd also like to make note of the contributions from Samantha St. Germain, one of our backpackers, and Janessa Mulgrew, a public health student in the creation of this project. We would like to begin by acknowledging that the land on which we gather is on Treaty 6 territory and the traditional territory of Cree peoples and the homeland of the Métis Nation. What do you expect today? We're going to go over a very quick project overview, goals, objectives, the data collection methods and findings, the strengths of our program, learning lessons, a backpacker perspective, and future resources. So the project came out of an application for a Public Health Agency of Canada grant on helping people who use drugs to increase their capacity and also to increase access to harm reduction supplies. So in response to that, we put together a peer-led improvement project involving people who use drugs to provide needle distribution through backpacks and harm reduction vending machines. And we were successful based on the model of 4 components: community engagement, peer empowerment, access to harm reduction supplies, data collection and analysis. Our intent was to conduct community consultations to recruit peers to the project so that they could not only have input, but also oversee many parts of it, orientate the peers to secondary distribution and give them training and increase their knowledge, support the peers to oversee the vending machine filling and maintenance. And then we also wanted to do some data collection analysis, which included doing quite a bit of surveying and recruiting a public health student for data analysis. And so we were doing all of this with the 3 goals for our project, which was to increase access to needle equipment by 30%, reduce risk-taking behavior among people who are using substance and sharing drug equipment by 25%, increasing the capacity of peer backpackers by 25%. So we used several different things to quantitatively measure how successful the work that we had been doing had been. And the first was to see if we were actually giving out more supplies. And we did have an increase of 23% in needle distribution in the first 6 months. And as you'll see in the chart there, that was from the vending machine. We also seen an increase overall across all of the former health region. So it showed us that we weren't just replacing people who were coming to the fixed sites to go into the new services, that we were actually drawing a new set of people and offering a resource that they didn't have before. We also did several peer-led interviews and surveys, and these surveys showed a 26% shared drug use equipment decrease in the first 6 months. So we were really happy to see that. We were actually really surprised when we did the first survey to know that so many people had been still sharing equipment and not having safe access to equipment. And then we also showed an increase by 38% of average peer knowledge regarding harm reduction principles and access to care. And so the way that we measured this, you'll see my little picture there, that's me with several of our peers. We got to meeting about once a month and sometimes more regularly if we could. And during those times, we would have educational sessions and focus groups where they would share different things that they thought would help the community and the people that we were serving. And so we just did a pre and post knowledge test. And then you'll see I did include a little excerpt of our harm reduction survey that we used. We also collected some qualitative data, which often was just people coming up and telling different people of the team. And I just wanted to share a few of those. Our peer backpackers say, "Thank you for giving people like us, junkies, jobs. It helps us to feel useful. One of the things that brings me happiness is working on the outreach van. Until you told me, I never realized how I have met people just by telling them that they can trust you guys." And then people from the that were project clients would say, "Some of us do not like to go into the clinic in case someone we know sees us. I heard from my friends to call you, so I did it. Now I have support, a place to turn. How do I get a job working as a backpacker?" This was often asked to us. At first, we were kind of worried that we wouldn't have anyone that would want to be part of the project, but definitely lots of on-site job interviews and people doing verbal resumes. It is so real to have the vending machine. It has helped me when I decide to use last minute, when I have no needle and it's late and I just go there. So I've given you a quick overview and I have such a short amount of time of 10 minutes, but I just wanted to talk a little bit about the strengths of our program. So it helps build trust between people who use drugs and healthcare providers, allows for after-hour stigma barrier-free access to harm reduction supplies, provides opportunity for people who use drugs or used to use drugs to increase their capacity to improve as a person and to give back to their community, improves needle return rates, facilitates connections to STBBI testing and treatment, allows for promotion of supports, opportunities of services for people who use drugs. It allows for interdisciplinary collaboration amongst the peers, health, social work, community-based organizations, first responders, and even schools. So now I just want to quickly talk about how integrating peers into your team, it can be a little or a lot. So some of the examples that we've had is we've actually had them doing the formal secondary distribution where they come and get supplies and go out and offer referrals, information, needle distribution out of their backpacks. We also have had peers work at our fixed harm reduction sites. We started an outreach van in response to an HIV outbreak that we were having. And so we incorporated the peers. This project is aligned with that. So it was really great. And so we incorporated the peers as members of our team in the outreach van, handing out supplies, bringing people in for testing. Of course, we did have them integrated into data collection. So running surveys outside of our fixed sites amongst people who generally wouldn't even come and get surveys. So that was great to get a better understanding of what was really happening out there. Referrals. So lots of times they make referrals to myself for testing or, to counseling, to the ORS program, which is our methadone and Suboxone program. Basically anything that people are kind of asking them about, they'll talk to the team and we generally try to find ways to help those people. We built some community partnerships. Unfortunately, with COVID, we weren't able to get into the schools to do presentations we had planned, but we're still hoping to do that and talking about developing some Zoom presentations out of our clinic. They are the primary vending machine stockers. So looking after them, making sure that there's full 7 days a week. And I'm sure there's more ways that they've helped us out, different education classes that we do. The sky's the limit, really. So now I'm just going to turn it over to Samantha, and she's just going to share her perspective as a peer. So giving back and taking away.
I feel like my role is being able to help connect the people who are not connected to the health system to the health system. And like whether it's by telling them my experiences or just for them to, because I know a lot of people, just for them to just trust me and to trust you guys, because there wasn't a no trust whatsoever. Like a lot of the people who didn't trust you guys did not trust you guys, right? So like including myself. But after knowing, getting to know you and seeing with everybody else, and after they got to know the team, they knew that we were only there to help you guys. Like we were only there to help them and to either, I don't know if cure is the right word, but to make sure the sickness wasn't getting worse and to make sure they were just getting better.
Thanks, Samantha. So now I'll just jump into some learning lessons that we had along the way. Definitely, we had some learning lessons on security, communication, and safety. So it's really important to prioritize security of the vending machine. So cameras, having it securely mounted, having no real opportunities for people to do vandalism. So we kind of had to learn that the hard way, but we're happy to share some of our tips and tricks. Keep data collection simple so it's achievable for the peers. That's really important so that they can be successful in that. Require the peers to keep a phone or check in weekly at harm reduction. Regular, consistent team check-ins and focus group meetings really helped our team to move things along, keeps us all on track. Safe place for clients to keep work phones, bags, supplies, whether this is like lockers in your offices or space of their own. It's really important for them to have that for kind of a team atmosphere. Importance of standardizing the packaging and stocking of the vending machine, and then pairing up peers with the healthcare workers, like the model we did with the outreach van. All right, so I just want to thank a few people. I'd like to express our gratitude to the Public Health Agency of Canada for funding this project, the Saskatchewan Health Authority for agreeing to let us apply and pull off this innovative project. We're very thankful to both of them. The next step is we are working on the creation of an orientation onboarding video for people who want to try out something like this. So that's coming the summer of 2021. We're really close on having that finalized, and same thing with it. It's going to be, kind of rolled out and evaluated on how it helps to increase knowledge and capacity for people who use drugs. So now I'll just leave you with some contact info and some websites. So this is our references around the work that we've done. The Saskatchewan HIV, Saskatchewan.ca, and I just want to make special mention to Katie.ca. If you're looking for more information around our project, I really do encourage you to go to Katie.ca, email me if you'd like the specific link, if you can't find it. And there's a project case study of our project there. And so we're really thankful for them for doing that. And huge shout out to Amanda from Katie for doing that for us. And we welcome you to go and take a look and some of our resources are there. If you have any questions, we're happy to take those when the committee sees fit. And for more information, please reach out to me. Again, I'm Danielle Radchenko, a public health nurse from Saskatchewan.